Welcome to our presentation. I have the distinct pleasure to introduce Dr. Geoffrey Leung. Dr. Leung is Ambulatory Medical Director at Riverside University Health Systems, and along with that, he's also the Chief of Staff at RUHS. Plus, he is being a wonderful leader during the COVID epidemic with the emergency operating team in downtown Riverside, and has contributed on many levels, but especially when it comes to discussing about projecting kind of the expectation of the COVID numbers and the testing information. And today, really excited about him sharing the information about testing and also contact tracing updates for Riverside County. He has a lot to share. I've heard many of his presentations, and always brings brilliance and really a solid understanding for what we need to know as healthcare providers in Riverside County. So thank you, Dr. Leung, for educating us all today.
Thank you, Dr. Flowers.
In Riverside County, we know that we've tested over 100,000 individuals, or over 5% of the population, with nearly 9,000 positive cases so far. And you know, this is from the Riverside County Public Health website, and you can, take a closer look at this if you're interested. But we know that in Riverside County, Hispanics and minority populations are disproportionately affected. When we look at the deaths, we also see that older populations are affected more, just as we've heard in the news across the country. So it's that 65 to 84-year-old category where we're seeing most of our deaths. And then this is a screenshot showing our new cases on a daily basis. So the orange bars represent the new cases reported each day. And then the yellow line is a 7-day average. So you can see that around mid-April, we had peaked. And then it was about 2 weeks after Dr. Kaiser had sort of ordered, masking and staying at home. We see that, around 2 weeks later, around mid-April, our new cases started to drop. But then over the past several weeks, you can see that we're starting to rise again. And that, we believe, is related to reopening that started around Mother's Day weekend. This is a complicated graph, but I think it's worth showing because it shows the testing, the total tests done per day in green. The blue, which is added on, represents the total positive cases each day. And so you can see the positive cases make up a very small percentage. And then the yellow line shows our positivity rate, which has been hovering around 7 to 8%, but it's starting to move upwards following the reopening. And the state wants to see our positivity rate less than 8%. So when your positivity rate is creeping up, it could be the first sign that you're getting an outbreak. This is our deaths by day, and you can see that our deaths with the orange line, which is a 7-day average, is trending downwards. And so, a lot of questions come up. It looks like we're identifying more new cases, and our positivity rate may be starting to turn upwards a tiny bit. Why are the deaths not tracking the same way? And the first thing is, there's always a delay with the deaths. So it could just be that we need to wait a little bit longer. Or it could be that because we're testing a larger percentage of the population, including asymptomatic individuals, that our mortality rate is functionally looking sort of lower and lower. And although the new cases are going up some, they're representing milder and milder cases. And then finally, this is our logarithmic curve, and you're looking for that to flatten like a tabletop. And although it's slowed down, you can see that we're not as flat as a tabletop yet because we still have new cases coming in. And then in the upper left-hand corner, we've tried to keep a timeline of significant events so we can see how changes in these lines might be related to other things like reopening. And finally, just a reminder that we have at least 16 community test sites right now for coronavirus, in addition to many sites that individual clinics have propped up, or hospital centers. So we do offer testing to all individuals, either with symptoms or without symptoms. And there's sort of two sets of two sets of test sites. For the county test sites, you see one phone number here, 1-800-945-6171. And then for the state-sponsored, you have a different number, 888-634-1123. You know, we think they're both just as good as one another, and we're trying to, you know, leverage the state support that so that we can do as much testing as possible in Riverside County. This is a reminder of where we are in terms of reopening for the state of California, and Governor Newsom has described sort of 4 stages, where stage 4 is everything is open, and stage 1 is kind of where we started. So we're somewhere in towards the end of stage 2 at this point, and on the left-hand column you can see those things that have already opened in Riverside County, and on the right side those things that have not opened. You know, there's similarities with our adjacent counties, but there are differences as well. So it can be very confusing, not only for us, but also for, you know, our patients and community. This is a list of what will be open as of Friday. So, you know, I won't read through it, but it's just to show that it's quite a few things. You know, gambling centers, hotels, gyms, museums, zoos, bars, as well as schools. Now, schools is sort of asterisked because in Riverside County, the schools are all closed through June 19th. But after that day, when sort of that order runs out, then, you know, theoretically, you know, summer schools and day camps can be opening up. And, you know, there's more and more guidance coming out from the state in terms of what, you know, what are best practices as these different groups reopen. So just a reminder that this is available on cdph.ca.gov. You know, the state is watching every county in terms of multiple metrics to make sure that we are, you know, prepared for either reopening or continuing to reopen. And I won't read through all of the metrics, but a couple of them are relevant to our conversation today. You know, one in terms of positivity rate, we already mentioned, you know, we need to stay below 8% as a threshold for our positivity rate. And then in terms of testing, you know, we want to be able to test at least 1.5 tests per 1,000 residents per day, which is about 3,600 tests per day. And we do have that capacity, but we're only probably testing half of that at this point. And so, you know, we do as much as possible want to encourage our patients and community to continue to get tested, because it not only helps us, you know, keep close tabs on where the infection is, but also from a state standpoint, you know, allows us to continue reopening as a county. When counties are not meeting all of the metrics or are starting to, you know, kind of look problematic in different areas, they can be put on a watch list, and theoretically the reopening could be sort of paused or even be put in reverse. And then finally, for contact tracing, you know, the requirement is to have sufficient staff, and we'll talk a little bit more about contact tracing right now. You know, maybe I'll get through this piece and then we'll pause for questions. So, you know, in terms of contact tracing and case investigation, we use these terms fairly loosely and sometimes interchangeably. But really the goal of all of this work is to slow down the spread of infection and to prevent outbreaks. So historically, you know, we've had case investigation and contact tracing as far back as we've been, you know, doing work for tuberculosis and polio and measles, and more recently HIV and sexually transmitted infections. Case investigation, you know, that definition varies with every county, but it usually refers to the process of, you know, talking with an individual who's tested positive and kind of, you know, figuring out who are all the other potential positive or close contacts for that positive individual. So it will always include household contacts, but then may include people from work, may include people from, you know, a grocery store if you were standing in line and you weren't socially distancing or wearing masks. So it's really about, you know, who have you seen and where have you been? And then contact tracing is really this idea of, you know, connecting, contacting, warning, and educating the individuals who've been exposed by someone who's positive. You know, when the contact tracing team reaches those contacts, they, you know, encourage them to stay at home, which is the idea of quarantining. Someone who's positive, who has to stay at home, is isolated. So those two terms are sometimes confusing, and we sometimes use them interchangeably, even though, in the public health word, they're very strict definitions. And then contacts of positive are asked, to monitor for their own symptoms and get tested. And, we do want to get everybody tested. Part of the reason is because 40 to 45% of the people who are tested, who are infected, don't have any symptoms. And so it's really hard to use criteria that are based only on symptoms. In the jails, in the county jails, we found that between 60 to 80% of those testing positive don't have any symptoms at all. And if you look at the ratio of positives that we get, when people with symptoms get tested in our county, about 1 out of 5 come back positive for coronavirus. And when people without any symptoms at all get tested, about 1 out of 20 come back positive in our community. So we have a lot of challenges when it comes to contact tracing. We need to make sure we have enough staff, that we have, advanced data systems. Sometimes there are concerns about privacy from the public standpoint. And so literally sometimes we'll talk with patients and we'll say, you've tested positive. Can you tell us, who else lives in your household, or who else, should we be contacting? And sometimes individuals don't want to share that. We do try to, let them know that, especially when we're talking to other individuals in a workplace setting, or maybe who were at a gathering, everything is done to keep that patient's anonymity in place. So when contacts are reached out to, and I would say the exception is household contacts. It's typically tough to keep that anonymity with a household, and usually, people are okay with knowing. But for a workplace, say I've been working with 5 other people in one space, what the contact tracing and case investigation team will do is the contact tracer will reach out to my colleague and just say, we wanted to let you know that somebody who you've been in close contact with has tested positive. And they won't say that it was actually me. And that's how they sort of preserve that confidentiality. And then they'll go through the steps. But lots of challenges. California has put a state program in place called California Connected. It includes an online training academy supported by UCLA, UCSF, and the California Department of Public Health. It includes sort of a uniform media campaign so that when individuals are reached by state workers, it'll be labeled as the California COVID team. Sorry, that's misspelled when people look at their call information to see who's calling. And California has a goal of having 10,000 contact tracers in place. There is a new data management platform that's being rolled out. It's sort of supported by Salesforce, and there's a partnership with Amazon as well. So Riverside County actually on Monday of this week started participating in this pilot using this new software. And so we have one team trying it out right now. The software should be very good long-term, but not all of the functionality has been built in yet. So we'll be adding more teams to the software as the functionality matures. So in Riverside County, as of yesterday, we have 160 contact tracers and case investigators who've been hired or who are already working and trained. We've been utilizing the statewide online training for contact tracing for all new hires. And then again, as we mentioned, we're piloting that new data management software program, which should be fantastic, once it's fully matured. And it will also be uniform across the entire state. And it will connect with CalReady, which is our state database for tracking kind of infectious diseases. So I just wanted to take a moment to share an example of contact tracing. And this is a stock image, but in South Korea, there was a fitness class dance instructor who on February 15th was identified as positive for coronavirus. And, South Korea is known for its contact tracing. So they've got, a statewide or countrywide program, very good technology and good staffing, as well as good participation from the community. From that one dance instructor, they found that she participated in a workshop with 27 dance instructors total. And they discovered that 8 of those 27 instructors all came out positive for coronavirus. They identified over 200 students of these these 8 dance instructors who were infected, and found that 54 of those students tested positive. And really, they kept going additional sort of layers. So then they tested 830 close contacts and found that 34 of them were positive. And then they went one more round testing the 34 contacts and found 418 more individuals to test. And by the end of this, going iteration after iteration after iteration, they had found 112 cases related to this single positive case. And they did all of this within 3.5 weeks. And I think this is a really good example of where we want our contact tracing to be. That's the level where we want it to be. And we're certainly not at that point right now. If you look at Riverside County, probably 17% of our cases are linked right now, which means that we know that case is linked to another positive case. So whether that other person gave it to the positive, or whether that positive gave it to the other person, we don't know. But our goal is, if we're doing a good job contact tracing, that percentage of linked cases should go up. And we know that every case, we should be able to track to a case before, as well as cases that we may have transmitted to. So I think that's a really good example of, excellent contact tracing. This is a visual diagram where they show the red boxes are the positive dance instructors. The yellow boxes were the positive fitness students. And you can see they even broke it down by time. And there's a reference there if anybody's interested in looking at the article. Green is sort of secondary transmission. Circles are families, squares are, diamonds are other contacts. But you can see they literally, traced it out in terms of time and space as well. So, kind of finally getting back to, what can we do from the community to support testing and contact tracing? First of all, I think as physicians, and providers, we have very unique relationships with our patients. So, they tend to have a lot of trust in us. And, however we talk about testing and contact tracing, whether it's, deliberate or sort of very subtle and unconscious or subconscious, patients will pick up on that. So, if we're really encouraging testing and we're supporting kind of, being fully transparent during contact tracing, I think, patients will kind of pick that up from us. So we do know that each individual and their behavior plays a key role in what happens with our county with regard to coronavirus. And we've got plenty of cases where it was one positive individual and their behavior, may have led to an outbreak or a cluster. And in the case of that South Korean, fitness dance instructor, she was actually asymptomatic to begin with. We also know that in Seattle, there was a church choir incident where from one asymptomatic individual, 51 out of 60 choir members all became infected, after practicing for 2.5 hours in an enclosed space. From your practices standpoint, being mindful of who's visiting your facility can be really helpful in case you do have a positive and a contact tracer does reach out to your facility. So whether it's, that you keep a really complete sign-in list of all of your patients, as well as visitors, for each day, or that you're, just notating in your charts who else is in the exam room, with the patient that you're seeing. All of those things can be really helpful. We would ask if you can encourage all of your patients to get tested. That's very important for us. We know that our testing isn't meeting the mark right now. And we're currently testing around kind of one patient for one test per 1,000 residents per day. And we really want to get to about 1.5 and eventually 2. And so the state could theoretically, say, what, you're not doing enough testing to be able to manage coronavirus in your county, and we need to pause you. And then finally, some anticipatory guidance, so that if you know that your patients are getting tested or you're encouraging them, either to get tested through your own clinic or facility, or that you're sending them to a community test site, letting them know that, in the event that they do test positive, they would expect a call from the public health department and the disease control team. And that would include a call from a case investigator and a contact tracer, and, to please be as candid and forthcoming with them as possible, as that'll support our community. So here are, some resources, and Dolores and team, please feel free to share the slide deck if you like. There is a phone number at the bottom for disease control in case you have very specific questions related to, quarantine or healthcare workers, or, what to do in specific situations. And then, this is an example of the opening, the landing page for the Riverside County coronavirus website. It has all of the graphics that I shared at the very beginning. It also has resources for the community test sites on the left side, as well as toolboxes for healthcare professionals and other different types of stakeholders. It also has sort of updates from our public health officer as well. And then finally, just a couple additional resources. I know this has already been shared out through RCMA, but ways of accessing PPE in case people are struggling with that is on the right side. On the left side is a Lancet journal on the impact of physical distancing, face masks, and eye protection on COVID transmission from just this past June 1st. So it's a very recent article. It's a great read in case you're wondering how much of an impact those measures have. And in general, each of those measures reduces risk of transmission by about 80%. And then finally, we do have an antibody study that we're anticipating for Riverside County that should start sometime in the summer. But it will be randomized, so people cannot just call and sign up for it. It's something where there will be an agency reaching out to our population at random. So thank you very much for your attention. I apologize for the late start and the technical difficulties, but happy to answer any questions, time permitting. Thank you.
Great, thank you, Dr. Leung. And several questions have been populated that I'd like to pose the question to you, and you provide the answer. And for anybody on the line, if you do have a question, please enter it in the chat box. So the first question is, should everyone really get tested? We work in a doctor's office.
So so first of all, there's testing from a community standpoint, and there's testing from an employer standpoint. We would be very cautious about requiring testing as an employer unless you're one of the groups that's sort of identified by the state. For instance, skilled nursing facilities may have that requirement. But for everybody else, we strongly encourage it. And again, the reason is you may actually have asymptomatic staff who are not coughing, who do not have fever, and who may feel very good, who may be spreading infection. And a good example also is in schools. So again, we're not saying that schools should require testing, but children are a really good example of a population where we think there's just as much transmission of coronavirus, but kids are even much less likely to have symptoms than adults. And when they do have symptoms, it seems to be much more mild, and they don't get as sick, but they're still spreading. So sometimes it's not the individual, him or herself, that we're most worried about. Sometimes it's the people that they're spreading to, and especially if they're spreading to vulnerable populations, or your patients or other staff members, or someone's bringing it home to grandma or grandpa. That's where we really get worried. So thank you for the question. We do encourage it and strongly recommend it.
Okay. If a positive test, quarantine, ? Then retest ? Okay to be around family, coworkers.
Yeah, so also really good question, a common question. So if somebody does test positive, they will be asked to isolate at home. It is okay to be around family members, because a presumption is that family members have already been exposed, but we would, encourage people to socially distance. And whether family members decide to wear masks is a different question, but definitely good hand washing helps. From China, we believe that the rate of household transmission is about 15%, meaning that the majority of household members actually don't get coronavirus. We still want people to take precautions, nevertheless. In terms of what to do after someone tests positive, there are two acceptable pathways. The first pathway is to wait the amount of time, wait the typically 14 days, but if you're a healthcare worker or, you haven't really been symptomatic, there are actually pathways that, you might be able to clear faster, say after 10 days. And that's a whole other talk by itself. But in general, we're not recommending retesting, even though that's an acceptable pathway. The problem that you can get into with retesting is if it comes back positive, that individual is sort of stuck. And we've seen that at skilled nursing facilities with individuals who we think probably are not shedding anymore. We've seen it with physicians, where initially we were kind of retesting as the default, and discovering that we might have a physician who continues to test positive for 4 or 5 weeks. And then, how you're kind of stuck in a quandary. So we recommend kind of waiting the 14 days for most people, 10 days if someone's been completely asymptomatic, or their symptoms were improving really quickly. And again, you can see the more detailed and refined guidelines on the website. So I hope that answers that question. Thank you.
Okay. There are so many tests that are said to be poor sensitivity and specificity. Where do we send people for reliable tests? Is CDC paying for these tests as promised?
Yeah, so good question. So, although there are many, many different types of tests to see if someone's infected right now, I usually try to think of it very simply as there are point of care tests where you can get results really fast, or there are tests where you have to send it to a laboratory. All the specimen collection that we do with swabs, either of the throat or the, nasopharyngeal swabs done at the community test sites, all the sites that we listed earlier, those are highly sensitive and highly specific. If someone is doing a point of care where you get a result in 15 minutes, usually that sensitivity and specificity is more limited. And that's where you tend to get in trouble more. It's not to say that you shouldn't use it, but the decisions you make should sort of align with the false negative and false positive rates of your equipment. And then I think I forgot the second part of that question, Dolores.
Is CDC paying for the test as promised?
So, the CDC is not paying for the test. Right now, I think the expectation is that if someone has insurance, their insurer pays for the test. And it's a very complicated algorithm. If the insurer has not figured out how to cover it yet, there's another way to get that reimbursed through the government. Uninsured individuals also, that test can get reimbursed as well through a special pathway. But all people should be covered for the testing at no cost. Sometimes we hear that it's free, but I think that that's a little bit misleading because we are paying for it. So whether it's the insurer or the state or the federal government, someone is paying for that test in the end. Thank you.
Thank you. Any word on the Google Apple exposure notification API?
Yeah, so I think there was a lot of excitement about this because this is really the same type of technology that Iceland and some other, similar technology to what some other countries that have been very successful at contact tracing have used. I think the challenge that we did not anticipate is there are probably greater concerns about privacy in the US. So even though these are framed as, anonymous and sort of confidential tools, I don't think we're seeing the uptake as we would have hoped. Now the app, sort of the software or the platform that's coming out across the state, which is for contact tracers, we believe will help, but definitely is not a substitute for, everybody, having an app that tracks and supports contact tracing. So, it's out there, but I think there have been, the community has not picked it up as quickly as we would have hoped.
Okay, thank you. National death rates for Hispanics are about equal to Asians and a few percentage points higher than whites. Why are rates higher in our county?
Yeah, so we know that race and ethnicity are sort of they're one way of looking at different populations, but sometimes there's also some crossover with socioeconomics. And so, we know that it's more complicated than race or ethnicity alone. There's probably a piece that has to do with income and education and even, perhaps density. We know that lower income individuals tend to live in larger households. So that may be more common for, whether it's Asians or Hispanics. And again, you're right, we do see some differences between what we're seeing in our community versus nationally. Nationally, we see the African American, community being impacted disproportionately, and we're definitely concerned about all of our minority populations in Riverside County, but for us, we're seeing our Hispanic population impacted more. I think any guesses as to why are all speculation, but it's probably a combination of some of those elements that we mentioned.
Okay, thank you. If coworker is positive, does other staff quarantine, stay home, get tested also?
Yeah, so I guess I would say there's the healthcare worker pathway and then the non-healthcare worker pathway. So if your coworker is a healthcare worker who is asymptomatic, if the employer allows for it, that healthcare worker who's positive and asymptomatic could theoretically wear a mask and continue to work. And the reason we created that pathway, we collectively across the country, is, there was concern as, what we would do if there's a huge surge and there aren't enough healthcare workforce individuals. If your healthcare site has enough capacity, certainly those individuals could stay home and quarantine. I think in most other settings outside of essential workers or first responders, so again, kind of outside of police and firefighters and, EMR and AMR, but for all non-essential workers in general, if someone is positive, we're asking that person to isolate at home. And then we are asking, to quarantine exposed individuals at work.
Okay. So would the same be true if a patient tested positive and the patient was in the waiting room, seen by the doctor, staff, etc.?
We see a lot of anxiety and excitement every time we find out that a patient has tested positive. And I think the natural response we get from our own staff is, everybody's nervous, did we get infected? Does everybody need to stay at home? From a public health standpoint, they would consider individuals exposed if we were not implementing precautions. So if you had a patient that was in the waiting room without a mask and all of your staff were not wearing masks and they weren't washing hands and they had close exposure to that patient, then we would consider all those individuals exposed. However, if you have actually asked all of your patients and visitors and staff to wear face coverings, then they would theoretically not be exposed. And obviously, if you've added layers of protection like social distancing and good hand washing and convenient hand sanitizer, and you're trying to minimize the time that people spend close to one another, again, that situation, you might have had a patient who tested positive, but theoretically no exposure to anybody else at that site.
Okay, thank you. Last question. What is the current turnaround time for the PCR test in the county?
Yeah, so what we're seeing is for the past several weeks, it's been pretty stable. We see generally a 2 to 3 day turnaround time for the PCR. We do know that there are different vendors that you can choose. So we've seen the turnaround times as high as 7 days when access was at its worst and when supplies was also at its worst. But in general, we're seeing 2 to 3 day turnaround for the testing that we do. And we also see that positives tend to come back faster.
Okay, I'm going to add one question on top of that, if I may, and that is, at what point do you think that it will be feasible for the providers' offices to begin testing their patients, or shall they continue to refer to the counties and state sites?
Yeah, so that's a great question. So, the county and the state community test sites are there to support all of our residents and all of you in any way possible. So, that we just want to make clear. That's why the appointment, numbers, people should be able to get same day visits very easily. We're trying to make that testing as easy as possible. But long term, and even right now, our other hope is that we want all of you to be able to do testing at your own sites, especially if you're wanting that. And we do think it will be more convenient for both yourselves and patients. We know that different sites might have different challenges, whether it's regarding, training or PPE. But, we do think long-term, if you're serving as the medical home for your patient, or, just as a trusted resource for your patient, for your patients to have to go to two places for different things can definitely be less convenient. So we want to be respectful and supportive. So, if your sites are not able to do the testing, definitely please continue to refer. If you want to try doing the testing on your own, we also want to be as supportive as possible. And we think that's important long-term and to make testing kind of sustainable in our community. Thank you, Dolores.
Okay, thank you. Well, that concludes the questions. So on behalf of the RCMA, I would like to extend our deepest gratitude to you for presenting today and for providing the leadership that you have done through this whole crisis. We certainly appreciate it. And I would just like to remind everybody that you can keep track of all of the information or most of the information that has been presented today on the county's website. That again, the link is here on the bottom of the slide. So you can watch the numbers of cases and testing and admits, I believe, admissions, as well as the deaths for Riverside County. And so that is kept up to date every single day, I believe, on the county site. So everybody should feel free to visit that site because it is a wealth of information. And then two other things before we close. I want to remind everybody of next week's webinar, which will be annual wellness visits utilizing telehealth. And we'll be working through some of the workflows, as well as what the CMS requirements are, as well as IHP's requirements and Medi-Cal's requirements for the annual wellness visit being done via telehealth. So I think that will help a lot of people that are doing your telehealth but concerned about meeting your quality measures or your P4P in taking care of patients without them needing to come into the office at this time. So that again, same time, same bat channel, if you will, and the notification has gone out on that. And again, on the RCMA website, we have posted the article that Dr. Leung was referencing today about the face mask. It is available. Plus, I will send it out to the people who have requested the document directly. So again, thank you for joining us. I'm sorry, one last thing, can't let you go away without knowing this. Again, the test results for COVID are on our health information exchange, Manifest MedX, on patients who have gone to be tested, whether positive or negative, and whether or not they've been admitted to the hospital. So if you are not a participant in the HIE, I strongly encourage you to become a participant and be able to look at your patients that have tested positive plus of course all of their other information if they've received care outside of your four walls. So if you have any questions or want to get connected on that, you can just send RCMA an email and we will connect you to the appropriate people. So again, Dr. Leung, thank you very much for your time, and to all of our participants, thank you for participating, and we're here and ready to help with whatever questions either during this crisis or hopefully when our lives get back to the new normal. So thank you again for participating.